Doctors enjoying patient visits again, finding joy in practicing medicine, spending less time on administration. A few years ago, this would have been fiction, but now this is the reality. And MedPeds, which implemented Sunoh.ai from eClinicalWorks, is achieving everything I just mentioned. A year ago, I spoke with Dr. Seth Eaton, the medical director at MedPeds. So I was really curious to get back together with him to learn more about their progress with AI in the last 12 months. And I wanted to find out how they were leveraging PRISMA, eClinicalWorks' interoperability solution, and how they were using it to improve the clinical decisions that they were making. Let's get to it. Dr. Eden, welcome back to the program.
Well, it's good to be back again. And last year we covered some new things with AI, and I guess there's some additional stuff to cover this time.
Yeah, I really enjoyed our conversation from last year. We were talking about the Sunoh AI tools and things that eClinicalWorks brought forward. But before we dive into some of the things that you're doing this year, can you just remind our audience again about you and your practice?
Sure. So our practice is a 10 provider group in Maryland, essentially primary care, internal medicine, pediatrics, family practice. We're about 75% adults, 25% peds in terms of demographics. And we went totally electronic in 2004 with eClinicalWorks and haven't looked back. And we've been early adopters of many of the technologies that ECW brought out, which included the patient portal and other features over the years. And so we were quite enthused with the AI Suno, or essentially the AI component of visit summaries. And we've been enthusiastic in other features of their AI product.
Yeah, I remember last year our conversation talking about how it was going to reduce a lot of administrative burden, it was going to reduce a lot of frustration, and make a meaningful impact on the lives of both clinicians, but also on your back office folks.
I would say the major improvement when we look back over the last year is just a sense of fun in practice again. And I think that is really the transition that those of us who have essentially AI doing our visits, we are enjoying the visits more. It's just more fun to talk to the patients and not have to focus entirely on the computer. Um, and then the sense of professional accomplishment, where my notes are much better than they used to be, as the AI helps improve the documentation in a way that my memory trying to finish the note the next day just couldn't do.
Well, Doctor, that's really encouraging to hear that you're getting some joy back into your practice, and
Yeah.
that's a result of the AI doing a lot of the ambient listening and documenting for you. And it sounds like it's really relieving that pressure of you having to remember everything that was said, and then you having to document either late at night or then even the next day as you.
And actually, one of the stories with AI is during every visit, issues may come up that I don't know the answer to, and I will take a look while the patient's in the room at the medical textbook up to date, and the patient is talking as I'm multitasking, listening to the patient, but also looking at the textbook. And I'm not always perfect at hearing everything the patient says when I'm focusing on the textbook. And there's been more than one occasion that I look back at the AI summary and there was something of importance the patient said that I didn't hear because I wasn't paying attention. And that actually is a surprising feature to the listening component of AI.
Well, that's encouraging to hear that it is making such a difference. Because
But I think the major new thing for us, and this is new really in the last few months, is the interoperability of electronic records, which we've been promised for decades. I mean, this was the whole initiative of electronic records going back to when the government sort of mandated this decades ago, is that we're finally getting records from specialists coming, even if they don't actually deliberately send them to us. So we've always had records that we got sent to us from the specialists, and we're getting a lot more because a lot more practices are being more diligent in clicking the button to make sure we get the records. But what's new is a feature called PRISMA, which is a uh, platform which pulls records from the hospital systems and specialists and primaries and puts it into a format that is viewable as a searchable um, database to see what specialists have to say. And I think that is the holy grail of interoperability that we've been planning on for decades that is finally beginning to happen. And the story that I would share from last week that was interesting is I was just doing a regular pre-op for a patient who was coming in for shoulder surgery. And I did the routine exam and then was reviewing the data that came from the orthopedist and looking at that report. I asked the patient, well, did the orthopedist tell you about a lung nodule that showed up in the MRI of the shoulder and the fact that your bones are a little weak that showed up in the MRI that come up? And the patient, of course, had not heard that. And this was just all part of the data that did not come directly to me from the specialist. In fact, I didn't get a note at all from the specialist, but it was viewable in notes that had come through the sort of shared cloud format that records are starting to go in a manner that allows providers to look at different records.
So essentially, you were able to see a note that you hadn't received at your office, but it was available because the other clinician had put it into some system that was now available via Prisma. That's
Correct,
amazing.
correct. And I would say almost without exception, every day there is some feature that is not coming through my records that I'm able to see through this interoperability platform that has some modest change in care for one patient. And probably if I had more time, I'd find something for many more patients. But it's also, every view of this interoperability platform is also time away from doing other things, and there's a limited amount of time I spend on it. So it's a very, very different benefit finally of having electronic records. And I think if we look back over, and we've been electronic for over 20 years, total electronic, the initial benefit was to the patient only in the fact that um, they could have our records be more um, legible.
Mhm.
But now for the doctors having AI doing the notes, it's an improvement in our lifestyle and improvement in documentation. And with Prisma, it's for the first time really an interoperability capability that is going to reduce the cost of care by reducing duplication of tests, reduce the cost of care by having improvement communication, and just do better job with care. And I think as more and more practices join this sort of cloud-based system, and this becomes more integral to practice, it's going to be a big change in how we practice. And what is nice about Prisma is there have been improvements in the searchability feature since it first came out last year. And when it first came out, we found that it was not very helpful because it was just too hard to find the data. But now they've tweaked the features so you have essentially a search field where you can search something, and they also have format in a way that makes it easier to navigate to find some data. So that's the big change in the last year that we appreciate.
And it sounds like it does add a little bit of work, but it seems pretty valuable when you do invest to go and look and see if these notes are available from other.
Well, when you look at notes from specialists, there's always time involved in looking at these notes. What's new is that now the notes sometimes can be summarized by AI that the specialists send us that may or may not show up when the specialists are sending us notes. But More importantly, there is a more thorough amount of data that's starting to roll in.
Mhm. And have your clinicians noticed or really did you have to educate your clinicians that this was available, or was this something that just sort of came about and
This required an intervention because the particular platform is really a separate platform from the basic
Mm.
EHR platform and is not intuitive how to navigate. So, like any software update, it requires a little investment in time. And this, I think, in our practice, there's still ways to go before it becomes really robust in its use.
of all the things that we heard about here so far at the summit, is there anything else that's sort of exciting for you this year that you've heard in terms of new features or
Well, I
functions?
think what is most exciting to me is the capability of using AI to help with phone calls that come in the office. The platform is called Genie, and essentially it's going to use an AI bot to help answer questions, which will, I think, improve customer service by people not waiting on the phone if they just want a simple answer. And it's going to also, I think, reduce some of our costs by uh, having fewer staff that need to handle questions that could be answered by something already connected to the system.
Awesome. Is there anything that you're doing outside of the EHR that you're excited to implement at your practice?
Uh, well, outside the EHR, we are certainly AI is working outside the practice as well. I mean, the story I will tell is a patient came in about 2 weeks ago who has HIV, and he was saying that he needs a refill on a medication that is treating his skin infection. And the medicine he wanted a refill on was an allergy medicine. I said, You're talking about a refill on this allergy medicine is treating your skin infection?" He said, "Oh, yes, when I use it, it really works." And this is Montelukast. Of course, while he was talking to me, I looked in the medical textbook. There's absolutely nothing whatsoever that this drug has anything noted in the immune system. And so I just asked ChatGPT if there's any documented studies. And in fact, there were documented research studies showing that it can have an effect, especially on staff, on the immune system. And I haven't reached out to the people doing the clinical trials of this drug, but this was an example where ChatGPT allowed me to find out something that the infectious disease consultant I talked to was just blown away that this was even possible.
That's an amazing story. That's an amazing story. And kudos to the patient for even knowing this or realizing that this was the one thing that was helping them the most. Well, Dr. Eden, thank you so much for being on the program again. It's always great to have you. Where can people go to find out more about your practice?
So it's called MedPeds, MEDPEDS, and we're in Maryland.
Amazing. Well, thank you so much for your time and always appreciate you being on here on the program.
Thanks so much, Catherine. Bye bye.
I gotta say, I am impressed with how MedPeds is getting value from eClinicalWorks' PRISMA solution. It's not often that you hear someone talk about a tangible benefit of sharing EHR records. I think that what Dr. Eaton and his team are doing is a great practical and simple example of what we all hope interoperability will be. And hey, if you enjoyed this conversation, please mash that like button and click subscribe. Also, head over to healthcareittoday.com where you will find more great content like this. I'm Colin Hung. Thanks for watching, and I'll catch you on the next video.